Hi class, my name's John. My current field placement is within a psychiatric unit in a hospital. Um, the population consists of adults with substance abuse issues. So every client within this unit is considered dual diagnosis. My first week there, I got to sit in on a family session with my supervisor while she discussed follow-up treatment after their daughter has been discharged from the hospital. Uh, I also got to sit in on a assessment where my supervisor showed me how she chooses comes up with an intervention after she assesses a patient. And she also showed me, various forms that have to be filled out um, when for every patient. Um, I'm hoping to learn more about these things. You know, uh, they do a lot. The hospital does a lot of linking up with other services because each patient can only spend 2 weeks within the hospital and then they have to be discharged. So the hospital within those 2 weeks has to link the patient up with services um, once they leave the hospital. So they have some place to go afterwards to get additional help. Um, so I like to learn more about how they go about linking these patients up with services, uh, working with the insurance companies. I am really interested in sitting in on more family sessions. I want to do family therapy in the future, and I think I will get a chance to do some of that uh, this field placement because they have family. They have days where the family can visit, and I am also hoping to learn more about the process of assessing clients and come up with a treatment plan for the clients. Uh, my past internship, I didn't really do any assessments. Did do any real family counseling or anything like that. It was more along the lines of trying to help the client, trying to integrate the client within the community. So each of the clients in my past internship, they uh, they had their own housing. So it was basically my job and the other caseworkers who worked there to teach these clients daily living skills so they can live on their own and not be as dependent on uh, on the organization I was working for. Uh, so, yeah, that's it. Thank you for watching.